Hi, everybody, and welcome to Healthy Living with Chef AJ. I'm Chef AJ, and if you're listening for the first time, I'm the author of Unprocessed and the creator of the Ultimate Weight Loss Program. You can find out more about my work at www.eatunprocessed.com. For those of you that have seen my television show, Healthy Living with Chef AJ, you know that one of the things I say every episode is that healthy living starts with healthy eating. And while I sincerely believe that good nutrition is the foundation of healthy living, there are other things that are just as important. And our guest tonight really specializes in one of these areas. And one of the things I think is just as important as healthy eating is fitness, exercise, moving your body. Our guest tonight is not only an expert himself personally as a former All-American runner, but in treating elite athletes and even lay people like myself of sports-related injuries or other orthopedic injuries. My guest tonight is Dr. Andrew Blecher. Dr. Blecher specializes in primary care sports medicine, has been practicing at the prestigious Southern California Orthopedic Institute, SCOI, for 10 years, where he has had the opportunity to care for a wide range of patients, from little league to high school to collegiate to elite and professional athletes, Olympic champions, weekend warriors like myself, and award-winning entertainers have all entrusted their care to Dr. Blecher to recover from their injuries in a quick, non-surgical manner. This is what I love about this guy and why I went to him. Dr. Blecher is also a leader in the growing field of regenerative medicine for joints, tendons, and ligaments, using biologic techniques such as platelet-rich plasma, abbreviated PRP therapy, as well as injections and advanced imaging such as musculoskeletal ultrasound. Dr. Blecher is able to accelerate healing for many acute athletic and orthopedic injuries, as well as provide non-operative, minimally invasive treatment for many musculoskeletal injuries that would otherwise require surgery or become chronic, untreatable conditions. Please welcome to the show, Dr. Blecher. Thank you so much for being here.
Hi, thanks for having me.
So I love that you're the non-surgical guy. That's why I went to you. It seems like, with all due respect to your profession, it seems that you go to a lot of, or first thing you want to do, and not only is that the last thing you want to do, you don't even do it. So tell us, what else can we be doing?
Well, that's a good question. As it turns out, about 80 to 90% of orthopedic and musculoskeletal problems don't require surgery.
Excellent.
A lot of them never make it to the doctor's office. But, the things that need surgery are the things we're all used to hearing about, things like ACL tears or knee replacements or rotator cuff tears. So those are the things that people usually seek out surgeons for. My field is non-operative primary care sports medicine. I tend to deal more with overuse injuries, even some acute injuries, the majority of which don't require surgery. I treat a lot through injections as well as prescribing physical therapy, bracing. There's a lot of non-surgical things that we can do, and I'm sure we're going to discuss those in depth tonight.
Absolutely. One of the things I wanted to ask you, because we're not really focusing on nutrition tonight, but as you know, just as a person living in the United States and also as a medical doctor, we have an obesity epidemic in this country. Something like 70% of Americans are overweight or obese. And I've been seeing people like in their 30s getting knee replacements, obese people, by the way. Now, I don't know how long joints are supposed to last, but I would imagine they're supposed to last a little bit longer than 30 years. And since my focus and specialty in life is on weight loss, how much of the pain and the suffering that you see or the joint wear and tear could be alleviated if people, really weren't so overweight?
There's no question that being overweight is a major contributing factor to joint pain. Arthritis, which is, probably the number one cause of joint pain in the United States, there are many risk factors that lead to it. Obesity is certainly one of them. Genetics is another one, which obviously we can't control. Injuries or trauma to the joint is another one which sometimes we can't control either. But certainly being overweight is something that we can control. Now, normal forces across the joint can go up substantially just by being overweight. So we sometimes think about, putting on an extra pound or two, really doesn't have much effect to a joint. It's probably a direct one-to-one relationship of, 1 extra pound that you're carrying around is just 1 extra pound to your knee. It's not a big deal. It turns out that that's actually not correct. If you think about the forces that go across a joint, like the knee, when you go up and down stairs, the forces are multiplied, so every extra pound you carry around is about an extra 5 or 6 pounds to your knee. So every single pound makes a huge difference. So you put on an extra 10 pounds, that's an extra 50 pounds of stress to your knee.
That's amazing because, Dr. Blecher, I actually heard a lower number. You don't know me very well yet, but I actually fractured my knee in an accident in February of 2010, a month before turning 50. And I never exercised a day in my life until I was 51. Well, because I was so out of shape, I couldn't use the walker. I couldn't use the crutches. So I was wheelchair bound for about 4 months. I put on even more weight. And what got me to lose the 60 pounds to look like the way you saw me today in your office is an orthopedic doctor actually said to me, he said, because they wanted to do surgery, and I'm deathly afraid of surgery. And he said, well, for every pound you're overweight, he said it was like 4 pounds of additional pressure to your knee. And then he said, you ever thought about losing weight? And I said, no, never crossed my mind. But I'm being facetious, of course. But that's huge because I would imagine knees, we have other joints that are impacted by overweight, the hips, every joint, I would imagine.
Correct. Every single weight-bearing joint is going to be affected by how much weight you're carrying around. And, oftentimes it's a vicious cycle. Patients say, well, I would lose weight and I would love to do it, but my knee is killing me, so I can't exercise. And if I can't exercise, I can't lose weight. So they kind of give up right off the bat. And, there are so many ways to exercise, many of which can be non-weight-bearing. So there are a lot of things I recommend to my patients. Getting in the pool is probably the number one best thing we can do. It's a non-weight-bearing exercise.
Absolutely.
The water resistance provides a way to strength train. You burn a ton of calories in the pool. So, getting in the pool and even just walking through the water. You don't have to do water aerobics. You don't have to swim. Just walking through the water in the pool is a great form of exercise. But that is excellent, as well as cycling or strength training. There's a number of things you can do that are really low impact to your joints that will help burn calories and help lose weight.
Right, and hopefully there'll be dietary changes that support that as well. But that's fantastic. I love all these things that you told me about that you do, that like the stem cell therapy. I remember what it was when my dog Ginger tore her cruciate ligament like 15 years ago. What you're doing now to humans, they were doing to dogs back then. And when you told me about this, it blew me away. And I looked up your YouTube on the doctors. Apparently, you did that to some famous guy's shoulder. You want to talk about that because that's really cutting edge.
Sure. Well, the whole concept behind regenerative medicine is to use the body's own natural healing abilities to help heal damaged tissue. A lot of what we do in orthopedics is not aimed at actually healing tissue. It's actually aimed at reconstructing it or replacing it. For example, if you have bad knee arthritis, you just replaced your joint. Arthritis is the wearing away of cartilage, and with a knee replacement, you're not finding a way to heal your cartilage or grow back your cartilage. You're just cutting it out and replacing it with metal and plastic.
Wow.
So that's what a lot of orthopedics is about. And regenerative medicine takes the opposite approach where, if your body's not healing itself on its own, what can we do to augment that healing process to get the natural healing process to occur? So if we look at the pathophysiology of the way tissue breaks down, everything in our body has the ability to heal if we can get the proper healing factors to the site of injury. So, for example, our stem cells are the cells in our body that are responsible for repairing damaged tissue, and these cells live in our bone marrow and they live in our fat. So when you injure yourself, these cells need to find a way from their bone marrow and fat where they're hanging out to the site of injury, and the way they get there is through your circulatory system, so through blood flow. And most of the time, that's not a problem. But if you injure a tissue that happens to not have very good blood flow to it, then the chance of it healing is fairly low. And unfortunately, there are a number of these tissues that don't have good blood flow. And the primary example would be anything that occurs inside of a joint. So if you think about the environment inside of a joint, there's synovial fluid, which is this clear fluid, but there's no blood inside of a joint. There's no blood flow. So when you damage your cartilage, there's no way for stem cells to get to that damaged cartilage to do the healing because there is no blood flow. So as a result, your cartilage is damaged. It never heals. It leads to further damage. You get this vicious cycle, and eventually you need to replace your knee. So the theory behind regenerative medicine is, well, what if we can just take the stem cells from where they are and put them to where they're supposed to get to so that they can do what they're supposed to do? So we harvest your stem cells from your bone marrow. We concentrate them, and we put them into the joint at the site of injury, and we let them do what they're supposed to do to heal the damaged tissue.
And it really works?
It does work. Unfortunately, there's a lot of people out there that are doing regenerative medicine and doing stem cell therapies, and they're not all the same, and some definitely work better than others. It's unfortunately not as simplistic as I just explained it, where we just put the stem cells there and they magically do what we want them to do. It's a lot more complicated. It's really involves the communication between the stem cells and your existing tissue cells. They need to talk to each other, because it turns out the stem cells don't necessarily grow into new tissue. They just tell your existing tissue how to repair itself and how to grow more of itself. So that communication is really important. So you need to have the right cocktail of growth factors and other things that are going to really get that communication to work at its optimum. And you really need to concentrate as many stem cells as you can get, because we do believe the more the better. And it's that right environment that really gets the healing process to occur. So there are a number of ways to do stem cell treatment. Everyone does a little bit differently. Unfortunately, there's not a lot of good research out there yet. So to be honest, people really aren't quite sure what the best way is to do it. This is still early on in the game. We're learning as we go. But the type of cell therapy that I do, called Regenex, is probably the most well-studied and well-proven type of stem cell therapy out there. We get very highly concentrated, highly purified products, and we've kind of seemed to figure out what the best way to get these cells to communicate with your tissue is.
Now, what are the risks? This is minimally invasive, but still, compared to surgery, I would imagine the risk is much lower.
Yeah, so the good news is that, we're using your own cells, so you're not going to have a reaction to yourself. There's really no downside to doing this. There's no surgery involved. There's no surgery center. There's no hospital. The cells are delivered just via an injection, so it's just a matter of sticking a needle at the site of the injury and injecting them, usually under some type of guidance, either ultrasound or X-ray or something, to make sure that you're putting them exactly in the right spot. So, with the proper guidance, it's pretty easy to make sure you're in the right spot, make sure you're not sticking the needle in the wrong spot so you're not injuring a nerve or a blood vessel. And the risk of infection, although it does exist, is exceedingly low. Knock on wood, I've yet to see an infection at all in any of the years that I've been doing this. So the risks are minute. The biggest downside to doing this, unfortunately, is cost. It is
I was going to ask you, is it more expensive than surgery, and is it generally covered by insurance?
Well, ultimately, it's not more expensive than surgery, but it is not covered by insurance, so the cost to the patient is much more. So if you have insurance that's going to cover most of your surgery, your out-of-pocket cost is pretty low if you go the surgical route. But with regenerative medicine, none of it is covered by insurance.
Wow.
So there's definitely a large out-of-pocket cost to the patient. And that's why, honestly, that's why this procedure is not for everybody. If it were covered by insurance, we would be doing this left and right. Everybody would be doing this. But unfortunately, it's not. And the cost is a major hurdle for a lot of folks. But, hopefully someday that'll change.
Well, but do you think that once it's more like proven in the medical literature that insurance companies will be more likely to cover it? Because it seems like with such little risk, surgery, people die all the time from infections and complications. And with such little risk, you think, is it because it's not been proven yet that they're wary to cover it as a benefit?
Well, there's a difference between, what is proven to be effective and what is going to be covered by insurance. And those two, sometimes are not mutually exclusive. So, people always, get worried, well, if insurance is not covering it, that means it's not FDA approved or it doesn't work. Or, that's not always the case. Remember, insurance companies make their money by taking your premium and then not paying for care.
Yeah.
They are companies who are in the business of making money, just like your car dealership or anybody else. They make money. So they are not going to pay for things unless they don't have to, essentially.
Right.
So insurance companies pay for things that are the standard of care. If they don't pay for it and you're going to sue them and you're going to win because they're holding back care from you, then that's not something they're going to do. They're going to pay for it. But if something is not yet the standard of care and they can get out of having to pay for it, that's what they're going to do. So, unfortunately, regenerative medicine is not the standard of care yet. It probably will be years before it will be. And again, the reason why it won't be the standard of care is because we don't do enough of it because it's so expensive.
Right.
So it's kind of a vicious cycle in that sense. In addition to stem cell therapy, the other thing I do is called PRP, which we talked about, stands for platelet-rich plasma, which is instead of injecting stem cells, we just inject the platelets, and the platelets have all the growth factors, and they basically send out the signal to recruit stem cells to an area. So it's kind of one step below stem cell therapy, although ultimately is achieving the same goal. That's much cheaper, and that probably is on its way to being covered by insurance one day, maybe in the next 5 to 10 years. So that'll be the first hurdle, is getting that covered. That is certainly more common. There's a lot of people out there getting PRP therapy. But stem cell therapy, I think, is much further down the road.
Right. Well, what's great though, you were an early adopter, and by the time this is covered, you'll be like the expert at it because you've been doing it for so long.
Yeah, we've been doing a lot of it. There's sometimes where we actually, although we say we wish it were covered by insurance, sometimes we need to be careful what we wish for. Insurance companies oftentimes will say, yeah, we'll cover something, but we're not going to pay you very much for it. And then it becomes prohibitive, not for the patient, but for us.
Sure.
Unfortunately, stem cell therapy is, a time-invasive and a cost-involving procedure requiring a lot of lab equipment and time. And, if it's not reimbursed appropriately, then physicians aren't going to want to do it either. So, sometimes we need to be careful what we wish for, because it is covered by insurance, but a very low rate. It's something we may not want to do either.
But it's great that people have options, because, you are in Southern California. You do treat a lot of celebrities. So there are people that do have the money for this. And for people like myself that are just deathly afraid of surgery and anesthesia, it's just great to know that this option exists, because a lot of people have never really heard of it.
Yeah, there's no question. If you are, in your 40s or 50s or 60s and someone tells you need a knee replacement, and you're an active person, you're playing golf and going hiking and playing tennis, and going skiing, if you opt to have a knee replacement, that surgery is going to change your lifestyle. There's no question. So for those folks that can't afford stem cell therapy, it is definitely a great option, because it's minimally invasive. There's minimal downtime. You're not going to have to give up those types of activities, and it's going to feel like a normal knee. It's not going to feel like you've got metal and plastic in there. It's going to feel like your own knee. So for those patients that can afford it, it is definitely a great option. And I always tell my patients, the biggest thing you have to lose is that this is not going to work, and you're going to have to lose some money. But if it doesn't work, you can still go and have surgery. There's no downside.
That's what I was thinking, that is the worst that could happen, because with all due respect again to your profession, I have 2 colleagues that had botched knee surgery, and and they're worse off than before they had it. And so I don't want people thinking that surgery always works either, because it doesn't.
Right, and then there's no going back from that. Once you've had your failed knee replacement, we can't then go back and do stem cell therapy.
Absolutely. So I think it's absolutely worth a try. How did you get interested in this?
Regenerative medicine actually has been around for a long time, at least in theory. There was something called prolotherapy that was around for a long time.
Yes.
Probably heard of that, where you inject an irritant, and that irritant stimulates the body's own response. There's another thing that's called just needling, where you just needle an injury, again, to stimulate a healing response. So the theory of regenerative medicine has been around for a long time. PRP really has just become popular with musculoskeletal medicine in the past decade. I've been doing it since about 2008, so it's been a while. It's really the introduction of the imaging, such as the musculoskeletal ultrasound, that has allowed us to really see these injuries in real time and to be able to guide our therapies to the exact site of injury, that has allowed us to be able to do this and make it work. Because if you can't deliver it to the right spot, it's just not going to work. So the recent advancements in the imaging is really what's turned people on to this. So I think people like myself have always been interested, but the technology has not been there to allow us to do it. But now that the imaging is getting so much better, we can really take a crack at it.
But speaking of ultrasound, you're doing a study, right, that compares the efficacy of the ultrasound with the MRIs?
Yeah. So MRIs are expensive. They're very good at looking at structures like cartilage, and it would be great if we could, follow patients, whereas we treat them, we could get an MRI every month or a couple months to see how they're doing and see whether these treatments that we're doing are effective. We want to see, are there changes in cartilage that are occurring when we inject stem cells? Are we actually growing cartilage? So we'd love to be able to follow it. But to do an MRI at the cost of $1,000, every month, is cost prohibitive. So to do something instead like ultrasound, which is quick and easy and much cheaper, would definitely be a great thing. So my study is looking to see whether that's a viable option, because we know that MRI, is good at looking at those things, but we really don't know whether ultrasound is as effective at looking at things like cartilage. We know that it is good at looking at tendon and ligament and muscle, but there really hasn't been much study out there on cartilage, so that's what I'm looking at.
Where will you publish this research? Because I read medical. I'm a science nerd, even though I'm a chef, and I love to read the medical journals. So where do you plan on publishing this research?
That's a good question. I got to finish it first, and then we'll write it up. I'll present it at a few national meetings, and then we'll work on getting it published somewhere.
That's terrific. Well, I was reading your bio, and listening is one of our regular listeners is a well-known blogger in Cleveland named Wendy, and it says you had trained at the Cleveland Clinic, but that you were actually the team physician for the NFL team, the Cleveland Browns. That must have been pretty fun.
Yeah, it's a lot of fun. The Cleveland Clinic takes care of all the professional teams in Cleveland, and as a fellow, we definitely do our part in doing that. When we did our fellowship there, the fellows like to refer to it as the Cleveland Browns Fellowship, because I think we spent more time with the team than we did in the hospital.
Wow.
They're pretty high demand. They want you down there, at the practice facility every day. So yeah, it's a lot of fun, but you have to enjoy it because it's so much work. If you don't enjoy it, you'll be miserable. Right.
Well, it sounds from your bio that you do practice what you preach. I mean, you look like a really fit guy, a tall drink of water, but it says you enjoy tennis, racquetball, scuba, all that kind. So do you really have time for it with your busy schedule?
I try, not as much now. I actually had surgery myself, 2 back surgeries about 3 years ago.
Wait a minute, you couldn't have just taken your own stem cells?
Yeah, you see, that wasn't around yet 3 years ago. Now it is. So actually, now that we're talking about it, I was just down in the Cayman Islands for the past several days. Today was the first day I was back in clinic, because there are some things that we can't do in this country, and one of those things is we can't culture stem cells. So we had talked about that in order for stem cells to work, you need very high concentrations of them. And so we believe the higher concentration, the better. So if we were to just harvest your bone marrow to get your stem cells, we'll get a certain number. But if we can actually culture them out over the course of several weeks, we can grow out thousands of times more stem cells, which would be even better. But unfortunately, the FDA says that if you do that, if you manipulate stem cells in that manner, then it is now considered a drug. It's not a cell anymore. It's an actual drug, and it needs to go through drug trials. So that's not something we can currently do in the United States. So there's a clinic developed through Genix in the Cayman Islands where we can culture out stem cells to get much higher concentrations. So that's where I was earlier in the week, checking out their facility. And while I was down there, I had my own stem cells harvested to grow them out. Wow. So in the future, I may in fact be injecting stem cells into my spine.
Oh boy, you're a little bit like a Dr. Frankenstein, huh?
Sort of.
Just teasing, of course. So how important? Because this is healthy living. How important is fitness and exercise? Very few people in our country. I think the statistics are something like 1 out of every 6 women, 1 out of every 12 men actually have some kind of regular physical fitness routine. How important is it? Why is it important? Not just to our overall health, like we all know cardiovascular health, but we have muscles and joints and bones and ligaments. We're sitting at a desk all day. That can't be good.
No, it's not. Our muscles, our tendons, our ligaments, our joints, everything was designed to move.
Right.
Humans evolved. We were never meant to be sedentary. So your muscles and your tendons have elasticity to them. They're designed to function with motion and movement. The cartilage in your joint is nourished by the synovial fluid, and that requires motion in the joint to get that fluid to move around to nourish your cartilage. So our musculoskeletal system definitely benefits from motion, and sitting around or standing around or lying around all day is not beneficial to the musculoskeletal system. So exercise is definitely important. When we see a lot of degenerative processes, people always think, well, it's because all these people are doing all these high-end activities, running and jumping and doing things, beating themselves up. But oftentimes it's the people that are inactive that really have the worst. We call them overuse or degenerative injuries, but it's the non-use injuries where we see these tissues just deteriorate and degenerate from not being used. So there's no question that being active and fitness is important. There's certain things that obviously are better forms of activities than others, and things that are extremely high impact or collision sports such as football probably are not the best thing for the musculoskeletal system, but the majority of things that we do, swimming and biking and running and strength training, and all these things are excellent.
Mm-hmm. Well, I would imagine that underuse is probably as bad as overuse. For years, before I was a chef, I was an activity director at a retirement home, and it's just so sad to see these senior citizens. I mean, they've lost the ability to even get up and out of a chair.
Right. And as we know from our studies on osteoporosis, that weight-bearing activity especially is important for bone health, and being inactive puts you at risk for fractures, and there's definitely multiple benefits from exercise.
What do you think about those vests that they're touting now for osteoporosis, to wear one of those weighted vests as you walk around and just do your daily activities?
Well, I mean, it depends on the situation. I think there's plenty of people who are certainly on the overweight side of things that are carrying around enough weight as it is.
They already have their own vest.
So I don't think that's the case for everyone, but I mean, it probably has its place. But the more important thing, that's not an excuse for proper exercise. Just because you can throw a vest on, while you're standing around and doing your everyday activities is not a replacement for doing proper exercise.
Well, how does somebody get started? Like, I'm sure that some of my listeners have never, like myself, I was in my 50s before I started. I mean, I know you have physical therapy at your wonderful facility, which, by the way, does take insurance. SCOI is great, you guys. They have a doctor for every tendon and ligament in your body. There's a doctor that treats it. Trust me, I know. I just ruptured one, so it's a great place. And Dr. Blecher does take insurance. And if you want to find out more about him, his website is BlecherMD, BLECHERMD.com. He's got a lot of great articles and actually some YouTubes. I was watching the YouTube of you on the doctors, and the guy who tore his rotator cuff that you did this therapy to, did he get better?
Yeah, he's doing great. So he was an Olympic figure skater, and now he's really into playing hockey, and had an injury where he tore his rotator cuff, and this is one of those instances where it was a complete full thickness tear, which almost always requires surgery. In fact, even with surgery, there's a fairly high failure rate for treating these. So there was a good chance that he wasn't going to do well, but he is in fact doing great, and is back to skating and throwing his partner up in the air again, and doing all the things he wants to do. So yeah, he had a great outcome.
That's fantastic. So how does somebody get started if they've had underuse their whole life? I mean, do they go to a doctor such as yourself and see a physical therapist? And what's the safest way for somebody that has not been an exerciser or led an active lifestyle to get started?
Well, the first thing definitely would be to get a checkup. If you haven't seen your doctor in a while, especially, you want to get a physical and just make sure that you're in the right state of health to start an exercise program. Sometimes if you've already developed heart disease or some other medical illness, starting an exercise program might be something that would need to be watched carefully. So certainly getting in for a physical, you don't need to come see a person like me to do that, just seeing a regular primary care physician to get a physical, make sure that you're healthy enough to start a program. But with that being said, I don't think you necessarily need physical therapy or some formal guidance. I think eventually you can get to that point. But starting something on your own, be it just walking for half hour a day, either you can go to your local high school and walk around the track, or if you've got a nice easy trail to walk on, or just walking down the streets, just to get some exercise, to get your heart rate up, start burning some calories. Walking is a great form of exercise. Otherwise, as we said, getting in the pool, if you've got access to a pool at your local gym or the YMCA, or if you have a pool at home or your community pool or whatever it is, get in the water and just walk through the water, or join a water aerobics program. Or if you've got a bicycle, just get out and ride around the neighborhood. Simple things just to get your heart rate up. We usually recommend 30 to 45 minutes of exercise at least 3 times a week. And then you start building on that, then you can start becoming more competitive and get your heart rate up to higher levels and start burning more calories and go from there.
You mentioned that water exercise is good, and you also mentioned that biking was good. And I do something called spinning, and I'm going to be a speaker on a cruise ship next month, and they have underwater spinning. It's like the best of both worlds.
Yeah.
That sounds amazing. Why do you think people are so reluctant to exercise? I mean, in our society, it's just we've really become a nation of couch potatoes.
Yeah, I think everybody has their own excuse, whether it's they don't have time, or their joints hurt, or whatever it is. There's always an excuse for something you don't want to do, and I think exercise. I don't know where along our development of culture it kind of made its way out from the usual activity of what human beings do. There was a time where you didn't have to make time or room for exercise. It was just part of what we did in terms of
Right.
physical labor and a means of surviving. But as technology advanced, and I think the American way is to figure out a way to be as lazy as possible and get the most amount of stuff done. Right? We want to invent stuff so we can do as little work as possible, but still get a lot done. So. Somehow the intellectual capacity has increased, but the physical capacity has gone down, and now physical activity is more of a luxury, and that's unfortunate.
It's funny, but I was just thinking a way to make people active is if there was a way that we could somehow attach our computers or our iPhones to some kind of treadmill or bike, and the only way we could check Facebook is if we were pedaling. I think then everybody would be exercising. That would probably, I don't think it helped that they cut PE out of schools. I remember when I was in high school, that was like the last year. There was no more, I mean, we used to have to do it as part of our day, and now it's not even in school anymore.
Yeah. Starting exercise early at a young age is important, just to make that part of your lifestyle is to be active.
It just seems like that is just so hard for so many people, and I don't know how. I mean, I just want to tell everybody out there that I did not start exercising until I was 51, and now you can't stop me. I was in Dr. Blecher's office today showing him how I could put my ankle behind my head. I don't know if he was impressed, but the point is that came from doing yoga for 3 years, and it also makes it. The other thing, Dr. Blecher, is if people are overweight, when you exercise, it makes it easier to stick with a healthy diet. It just is.
Yeah, no question.
Yeah.
And I think exercise, is somewhat addictive. And as you start doing it, you feel better about yourself. Your mental capacity improves. You get a little bit of an adrenaline rush. It builds upon itself. You start feeling stronger, more confident, more limber. So I think once you get going with it, people really continue with it. But it's that first hurdle of getting started that is difficult for so many people.
Absolutely. So it's funny. I was thinking about your profession of orthopedic doctor, because in other areas, like for instance, we're supposed to see our dentist once or twice a year, even if everything's fine. And usually we see our internal medicine doctor maybe once a year for a checkup, and even they're recommending you go to the dermatologist once a year for like a skin check. But it seems like we never see you unless something hurts.
Yeah. I like to consider my profession as being episodic. So, people see me for a problem, and hopefully we make the problem better, and then don't see me again until they hurt themselves again.
Yeah.
But hopefully, if people are continuing to be active, then something eventually always comes up. But there are those people that somehow, for whatever reason or another, just don't get better and kind of become lifelong patients.
Well, are there ways that you can tell us, like, how we can prevent injuries in general? Are we wearing the wrong shoes? I mean, what? Because I'm sure you see a lot of injuries from things like running or things that people are doing at the gym, maybe doing incorrectly. How can we avoid going down that path and having to see you?
Well, there are so many factors, and we can kind of go through them. One factor is training error. So, a lot of people think more is better and start to, as they get into exercise, get, very, as you say, addicted to it and want to do more and more and more. And so there are a lot of training errors that occur. People do too much too quickly and don't get rest, and rest is extremely important. I mean, it's good, we're talking so much now about getting into exercise and stopping the rest, but, even once you get into exercise, still having that period of rest and recovery is important. If you're exercising every day, 365 days a year, that's not good either. So we want to make sure that the body has appropriate rest and recovery. We usually recommend 1 or 2 days per week of not doing your sport, and 1 or 2 months per year of not doing your sport so that you get adequate recovery. And some people don't get that. I mean, especially if we think about our kids, kids who are growing, and probably it's more important than anyone else that they get appropriate rest and recovery. They don't get it. They play their one sport at an early age, 7 days a week, year-round. They specialize really early, and we see a lot of these overuse injuries. So definitely training error is one big important factor. You need to make sure there's appropriate rest and recovery. Number 2 is equipment. So, things like footwear and sports equipment, helmets, if you're playing a sport like football. Sports equipment is important as well. You need to make sure that you've got the proper equipment. Another big factor is technique. So if you want to get back to talking about running, so running mechanics are important. And I think everyone at some point, if they're serious about running, should undergo a running evaluation where someone actually looks at their mechanics. You can either do it formally, or you could do it formally where you run on a treadmill and videotape it and look at your mechanics, because people don't really learn. I mean, everybody knows how to run, but no one really learns how to run. So, people just start running, and they're running incorrectly, and having bad mechanics certainly can lead to injury. So if you're serious about it, I think, looking at your mechanics, no matter what sport you're doing, whether it's swimming or golf or tennis, you really want to look at your mechanics, because if it's a motion that you're going to do over and over and over and over again, if your mechanics are bad, you're going to get an overuse injury.
As a chef, I got one from rolling out biscuits, actually, in my wrist. So
right.
Yeah. Is there a place you recommend that we buy our shoes, or get, like, is there, obviously you don't go to Payless to get your running shoes. So are there certain types of stores or people that really know what they're doing when we're getting fitted for athletic shoes? Are there brands you recommend?
There's no question. There are definitely stores where, the staff are more well-trained than others. If you walk in the store and you see some, high school kid who's just throwing a bunch of shoes at you, probably not the best situation.
Is there a place you recommend personally that maybe if those of us in Southern California could go to?
There are around, and it depends on where you live. Let's see. In my area where I am, in Santa Monica, there's a place around the corner called Top to Top, which is pretty good. There's a place in the valley. In Encino, I believe, used to be called Fidipides.
Yeah, I've heard of Fidipides. Yeah, they're really good.
They changed name, and now, gosh, I'm trying to remember what they're called now.
It's in Encino on Ventura. I know.
On Ventura Boulevard. It's in the same shopping center as Tony Roma's.
Yep.
The name escapes me at the moment, but they're very good there.
Yeah, just don't stop the ribs when you go.
Yeah. In the Santa Clarita area, there's a place called Runner's Lane, which is very good. They'll watch you run the treadmill. So there are definitely places around where they know what they're doing.
So, you mentioned that also to get adequate rest, and also I believe that another one of the pillars of health is getting good rest, getting good sleep. And we're going to be having a sleep medicine doctor on the show very soon. And, the other thing is people are taking these drugs to go to sleep. And if people would exercise, they'd be able to go to sleep, because it makes you tired, and you don't have trouble sleeping when you exercise.
Right. There's no question. I mean, I know from my own experience that times when I've been really busy and haven't had time to exercise, it's much more difficult to get to sleep as opposed to when you're exercising on a regular basis. Yeah, if you fatigue your body, your brain will be fatigued too, and you'll be able to get to sleep. But otherwise, it can be difficult.
Yep. So we have a couple of questions from our listeners that I was able to get it on Facebook in time. And so if you don't mind, I'm going to ask you, I have 2 questions. One of them is a lady writes that she has chronic extensor brevis tendinitis. Do you have any recommendations or exercises to do for this condition? Can it be fully healed?
It depends on what the cause is. So it sounds like it's probably an overuse injury. I don't know what it is that she does for work or hobbies, but it's probably something that she's doing on a regular basis that she's either doing too much of, which again would be the training error, or doing not correctly, again being the mechanical problem. So to solve the overuse part, she needs to back off on whatever activity it is that's causing the problem. And then the second part is to look at the biomechanical, the training error problem, the overuse aspect to it. Because if she doesn't change those things, even if we were to do something to heal the problem, like a PRP or a stem cell or whatever it's going to be, she just goes back to making those same errors. It's going to come right back. So the first thing is figure out what's causing it in her everyday life, and stop that and modify those things. So if it's what she's doing at work with the computer, or what she's doing for a hobby, whatever it is, you need to identify that and modify that. So that's step one. And then the second would be to get into either see a physician or a good physical therapist and start some treatment. Whether or not she might need some imaging, such as ultrasound or MRI, would depend on the specific situation. But there's no question that there's treatment available for that.
That's great. Thank you. And I have one more question. This is from a 60-year-old female, and she says she is missing cartilage in the medial, femoral, condyle, posterior, weight-bearing aspect of the left knee. Boy, I didn't even know we had one of those. And she's allergic to NSAIDs, to the nonsteroidal anti-inflammatory drugs. She was told not to do any pounding exercise, but even biking hurts. Is there a good way that you can recommend that she gets her cardio in? Are there any other type of treatments other than knee replacement?
Sure. So in terms of exercise, as you said, getting in the pool is probably the best thing she can do. It's non-weight bearing. There's water resistance, so help with strengthening the muscles around the joint. And then the motion in the water actually feels good to joint. The turbidity of the water and the motion of the knee will help with the synovial fluid to help nourish the cartilage. So getting in the pool would be the best form of exercise for her. In terms of treatment, there's no question that we can do things to help with this. One of the simplest things we can do that is covered by insurance actually is to inject a lubricant into the knee.
I've heard of that. What's that called? There was a brochure in your office. It's say the name. Would you mind?
Yeah, so it's called viscosupplementation, and basically what we're doing is we're injecting something called hyaluronic acid, which is actually the same stuff that you inject in your face as a filler, but it has a lot of lubricating and cushioning properties to it, and we just inject it into the knee to help reduce the symptoms. And it can be very effective. Up to 90% of patients get relief, which may last for 6 to 12 months. It's not cortisone, so there's absolutely no downside to doing it. You can do it every 6 months forever if you wanted to.
That's great.
And it is covered by insurance. So that's a great first step. If that doesn't work, then the other treatments we were talking about, the PRP and the stem cells, are excellent, and those would be excellent, alternatives to knee surgery.
Because it always seems like every time I've seen, a doctor, they always want to give you these nonsteroidal anti-inflammatory drugs, and I'm personally allergic to them as well. I'm an asthmatic, and I can't even take aspirin. Are these drugs even that effective? It seems like there'd be risks taking these drugs long term.
Well, there definitely are risks. The drugs themselves really just treat the symptoms of the problem. As an anti-inflammatory, you're reducing your body's inflammatory response, and the inflammatory response actually is the healing response.
Sure.
Because when there's too much of it, it's uncomfortable, and it gives you swelling and pain. So by reducing the swelling, you're making your symptoms feel better, but you're not helping your body heal at all. So, long-term use of NSAIDs is not actually helping anything heal. In fact, it may be detrimental. In addition to the risks of the NSAIDs affecting your stomach, causing ulcers, they can raise your blood pressure, they can affect your kidneys. So there definitely are those side effect issues as well. So we don't recommend that you take NSAIDs on a regular basis chronically. Certainly you could take them episodically when you've got a flare-up of some type of injury, but to take them every day is not a good long-term solution.
Right. So you had mentioned you had several back surgeries, so it must make you a little bit empathetic treating your patients because, that's you actually were a patient for.
Yeah, there's no question. It's not fun being on the other side of the needle or the other side of the knife. I prefer my side.
There just seems to be so much. You specifically treat the lower half of the body. Am I correct? Or
No, I treat everything.
You treat everything. I didn't know that. So, but it just seems that back pain is just so common now in our society. Is it one of those? I can't believe that it's just genetic. Is it we're sitting in the wrong chair while we're at our computer? Is it we're just overweight? We're not exercising? I know that even Dr. Barnard, who I'm going to be interviewing in May, says that a lot of times those arteries get clogged. Even with a bad diet, some of those major arteries that supply the discs can be impaired by poor diet. So what is up with all this back pain in our country?
Yeah, it's definitely multifactorial. Being overweight is certainly a huge risk. And being sedentary is probably the biggest risk. Probably the worst thing you can do for your back is just sit around all day.
Right.
Being in that seated position, especially in the car when you're driving, is the worst thing for your back. And our commutes just get longer and longer and longer. It seems Americans spend more and more time in their cars, and that's just the worst position for your back. So, the more you can get out and exercise, the better off your back will be.
Any special beds do you recommend for people with back pain, like sleep number beds? Or now, I hope if I tell you this, you won't tell me I'm doing something wrong, because I actually did break my back. I sleep on a waterbed. Is that bad?
I think it really depends on what position you like to sleep in. If you
sleep on my back.
Your back, if you
sleep
on your back, then I think you really want more of the firmer surface. But if you're a side sleeper or stomach sleeper, then having a soft surface is not something that's bad.
Oh, interesting.
But most of us toss and turn, so it's hard to say.
Yeah, I don't know. Yeah, I have to put a camera on. I don't know if I toss and turn, because I seem to wake up in the same position that I started in. So, yeah, that's interesting. So you'd mentioned you treated a lot of football players. I mean, so concussions, I was reading, is one of the things you're also very interested in, the concussions in professional athletes.
Right. Yeah, concussions are quite common, especially in football. During football season, I probably see upwards of 5 or 6 concussions a day in my clinic, and then in non-football season, maybe 5 or 6 a month. So there's no question that it's related to the types of activities people do, and it's become an epidemic. Not only in football, but we see it a lot in women's soccer from the repetitive heading. Concussions. So it's quite common.
That is crazy. Yeah, that's absolutely crazy. So tell us a little bit more about what you do, because I'm always interested, because I think it's inspiring when you hear, when I interview like the heart doctors and they eat a healthy diet, it helps people know, hey, well, he's doing it too. So what do you do for your lifestyle? Like I know you don't have a lot of time, but when you do exercise, what do you do and how much of it do you do?
That's a good question. I actually get in the pool almost every day. Not by choice. I actually don't like swimming.
Oh, okay.
Even though I tell all my patients to do it, but as I said, I've had a couple of back surgeries, and there's no question that getting in the pool is the best thing that I can do for my back. When I get out of the pool, I feel like $1 million. The water resistance, the being non-weight bearing is fantastic. So I try to get in the pool. I would say probably about 5 times a week.
And are you swimming laps, or are you doing some kind of exercise?
Both. I swim laps. I run in the pool. I do exercises. So I try to mix it up. I think to just swim laps every day for an hour at a time is pretty boring.
It is boring.
So I try to mix it up and try to keep it interesting. But there's no question, even for myself, I go to the gym and I have to psych myself up to get in the pool, to actually, jump in. It does take a little bit of psyching myself up to do it. I don't enjoy it, but once I'm in, I'm actually going. It's great.
That is true. I agree. It's the hardest part is like getting there. But once I don't know anybody. It's like what I was saying in my ultimate weight loss program. I don't know anybody that's lost 100 pounds and said, oh, I felt better before. And it's the same thing with exercise. It's that psychological motivation or lack thereof. It's like once you get there, you do it, and then you always are like, God, I'm so glad I did it. And
right.
But if we could just figure out that missing piece of why it's just so hard to get there.
Yeah.
That is the hardest thing. I agree. But if people would just do it, they would feel so much better. They really would.
No question.
Yeah. So physical therapy seems to be a big part of your practice. And so what do we look for when we just go a certain amount of visits that the doctor orders, or is this something, because physical therapy sounds like it would be just fun, to have somebody work with you like that.
Yeah, physical therapy used to be something that you really needed to go see the doctor first to get a prescription. But now there actually is direct access, so you don't need to see a physician first. You could certainly see a physical therapist directly, let the physical therapist evaluate you and see what your needs are, put you on an exercise program. They'll kind of guide you on how to do the exercises appropriately, make sure you're comfortable doing them on your own before you start doing them on your own and unsupervised. So physical therapy is excellent. I would say certainly if you've got a significant injury, you probably would want to see a physician first so that you can make sure the injury is correctly diagnosed, and you get a prescription to go see the physical therapist so the therapist knows specifically, what they're working on and how to give you the best program and really tailor it to what you need.
Yeah. That sounds like something I would just love to do, because like you say, they really teach you how to do the exercises correctly, and that's, like you said, so important, the biomechanics, and that because when you don't do it correctly, it can really cause injury. Is there a most common injury that you see related to a certain type of exercise that you seem to see more and more over, so that we can avoid whatever that is?
It's hard to say. I see such a wide variety of injuries. Things certainly come in waves. When the Wii and all these home video games started coming out, we saw a lot of injury from all these people who aren't used to exercise, but they start running in place in their living room with their video game and start getting injuries from that. And then people start doing more and more texting, and we see thumb injuries from texting.
I'm going to say our ancestors, probably in a few more generations, we're going to have the thumbs the size of our big toes. I personally have an old flip phone. I've never texted in my life, but I see these people, and it seems like they've got, like, their thumbs are hurting now.
Yeah. So, things definitely change according to, what we're doing and what we're doing incorrectly.
That's hilarious. That cracks me up, actually. So, is there anything else you're passionate about, or you would like to talk about as far as your work? I mean, I hope people will check out your website, Blecher MD, BLECHERMD.com. You've got a lot of great articles and some videos on there. And what's really cool is, for those of you that live in LA, you could see Dr. Blecher. He's at SCOI. I think you have 3 offices, don't you?
Our group has about 7 offices. I go to 3 of them. Our main office is in Van Nuys, and then I also go to our Santa Clarita office, and then I also recently opened an office in Beverly Hills.
Wow, so you can see everybody. Yeah, I really like SCOI. I'm new to it since last year, but I really like everybody there is very, nice and helpful, and it's just great that you see all the different body parts, so it's terrific. So if they want to follow you on Twitter, what's your handle?
It's at _JocDoc.
That's great. So are you pretty active tweeting? I should go follow you, because I'm not as much on Twitter, but you got anything good to say on Twitter?
Yeah, I definitely go through my phases. I'm on there a lot, and then I might ignore it for a week or 2, and then I'm on there again. So, but yeah, if you're interested in what's going on in the world of sports medicine, definitely follow me and keep you up to date.
I don't know if you know this, but in my field of plant-based nutrition, there are several elite athletes who you may or may not have heard of, like one of the fittest men in the world, Rich Roll, ultra marathoners, things like that. And we find a lot of times when people change their diet and they get slim and they get healthy, the next step is the fitness, because they become like addicted to exercise.
Right.
Which is I see that a lot in recovering alcoholics, for example, because they say that we never really give up our addictions. We just trade them, hopefully for a healthier one. But I do see that a lot when people are getting healthy and they lose weight, then exercise becomes, the next thing. So it's not always the first thing. Did you know Jack LaLanne, or do you know much about him? He was my hero.
Yeah, no, I never knew him personally, but yeah, I certainly know about him.
But I mean, because it's just proved that, that we're not meant to just, like you say, sit in a car all day, lay in a bed all day, sit at a desk all day, because he exercised every day of his life until the day he died, which was, I believe, at something like 97, which just shows your parts aren't supposed to wear out, or if they are, not when you're 30.
Right.
Yeah. Well, gosh, you just know so much about this, and you're so passionate about this, and I hope people will consider, these other options necessarily before jumping right into surgery, because like you say, they're safe, they're minimally invasive, they're extremely low risk, and the worst happens is it doesn't work. You can always get surgery, but once you get surgery, you can't do the other thing.
Right.
Right. So, well, great. Well, thank you so much for your time. I really appreciate it. And thank you all so much for listening to Healthy Living with Chef AJ. I'm Chef AJ, and I make healthy taste delicious. Good night, everyone. Thank you, Dr. Blecher.
Thank you so much for having me.